welcoming into the show Paul Seegert, managing partner at PCS Advisors, at PCS Advisors on Twitter. Paul, thank you for coming on tonight.
Thanks for having me again.
Yeah, so it's good to have you here, and happy Thanksgiving Eve.
To you as well. Yeah, got 5 kids, just getting to bed, and we've got big plans for tomorrow. We're going to play some charades and have some fun.
That sounds wonderful. So let's run through here. You have the record high enrollment in the Affordable Care Act marketplaces. What's driving that?
Well, we've got an unfortunate trend, I think a pretty alarming trend, really, although for the most part, on your show we'll talk about it, but I don't see it in the media enough, I don't think, where we're pricing out small employers from being able to afford to provide coverage to their employees. And many of them are just simply throwing in the towel. If you look at where we were 25 years ago as a country, 2 out of 3 of us got our health care at work. And today, just this year, we've passed, I think, a concerning mark where now less than half of us get our coverage at work. 49% of us get our coverage at work. And I know there are a lot of folks out there that say, hey, that's fine, that's good. We spend too much on health care as a country. We should make it more efficient. And all those things may be true, but we have a healthcare system in this country that's built on the profitability coming from commercial payers, employer plans. So we are in a place now, this is one of the factors, there's others included, but 53% of the hospitals in this country will post an operating loss this year. And they don't operate on really high margins. It's about 6%, considered a good margin for a hospital. So they're not in a strong position because they used to be able to count on, they lose money when Medicare, Medicaid, exchange plans, when those customers come in, they lose money. They need 120, 140% of what they might collect. And then historically, they were able to withstand that because they knew someone else was going to come in the doors who got their coverage at work. And they would charge those plans considerably more. A RAND study in the last month and a half pegged that at 224% more. And I think, without going into the weeds on that, I think that's pretty kind. So you have this situation now where these commercial payers are declining. We're forcing them out of the market, making it too expensive, pushing people to government-subsidized programs that don't actually pay providers enough to cover the cost of care, which leads to rural hospitals closing and puts our whole system, I think, at risk. So to me, this is a pretty serious situation that we have, and I'm glad we're talking about it.
So I'm glad that we can kind of get an understanding of this as well, because I don't think most Americans realize that huge shift has occurred from the majority of Americans getting their health insurance from an employer-based plan to the current situation. And so it means that people are either going to seek out other options like health sharing or something like that, or they're going to go to the ACA, the marketplace, because there are huge subsidies available right now. But that could change.
Right.
The subsidies are not written in stone. They're not legislation. So while there is a Democrat in charge and Democrats are running, the government, they support the ACA, so they will give very generous subsidies. But should a Republican be elected, those subsidies could theoretically change. A material change in the economic situation here in America, those subsidies could change. So, I mean, is it the wisest thing to kind of set your entire health insurance access, your ability to access health care on a government subsidy?
Well, it might make sense mathematically as an individual consumer, at least through 2025, since we've, as part of this whole kind of Inflation Reduction Act era and COVID Rescue Act stuff, we've injected many, many, many billions of dollars into the system to subsidize that kind of coverage. You could have a 60-year-old couple making north of $200,000 a year, and they can get a subsidy right now. that, and I think it's pretty fair or pretty reasonable to say, is that reasonable? And is that the best use of our money? But that exists. Now, there are some buyer beware elements to that. When you go and you buy coverage through one of these exchanges, or you get it through another government program, you are not the best. You're not looked at as the best quality customer for providers, because the reimbursements are not as good as commercial payers, commercial plans, government healthcare plans. So you have, as I mentioned a minute ago, you've got these plans showing up, these customers showing up at a hospital, and the hospital will lose money on them. And then there's others show up where they make money. That can impact your access and the quality of your experience. Now, if you show up with an emergent condition at a hospital, of course, they have to take care of you. That's part of how we run healthcare here, and I don't think anybody really argues with that. But when it comes to non-emergency situations, you need to get access to a primary care provider, a specialist, this kind of thing. It could limit your access if you're buying a product that reimburses the physician less than what it costs to treat you. And I think, and most people aren't aware of that that's going on, but once you become aware of that, it makes sense. You can't ask, in a free market system, you can't ask a person running a business to operate at a loss on a consistent basis. So you have large numbers of provider groups that just simply don't want it to, and oftentimes they tend to be the better performers. They simply don't want to take that coverage because they can't operate their business on the reimbursements that they get.
Oh, so that's pretty sad, because if people don't know that, they'll be wondering why their access is limited, or why the quality of care seems to be reduced. And it feels a bit like gaslighting, because they're not sure what's happening. They just know it's not good.
Yeah, they'll pull out, and then, they'll see people on the news that'll pull out a calculator and say, look, if we had single-payer health care in this country, everything would be cheaper. Well, that would be true if we asked every provider to operate at a loss, which, of course, would not work, at least not at the quality that we experience. We have people that fly to this country every year. We get 60,000, 70,000 Canadians that fly here every year to get health care procedures because they don't want to wait in line in their own system. And everything has to be rationed in some form or another. We ration by price, and they ration by line. And you have people from all over the world that will come here. So it's, you have to address that issue of cost. And when you look at what's happening right now with Medicare and the fact that providers are looking at another 4% reduction in reimbursements. Even though 53% of hospitals are going to post a loss this year, Medicare is going to come in and say, we're going to reimburse you 4% less, because they're continuing to squeeze the system and push cost to employers. When you say the word subsidy, most people think you're going to start talking about government subsidies, which are a real thing. But I think in the world of healthcare in this country, employers are the source of subsidy. And that worked okay 25 years ago when they insured 2 out of 3 people. The government could kind of ride on their back and say, hey, take care of our people at a loss because you're going to have plenty of other folks that you can overcharge. That's not going to work. That's just not sustainable that I can see into the future when you have a minority of folks showing up at those facilities that are getting their coverage at work. I mean, to me, it's a pretty scary situation that we've got ourselves into.
So what's the solution here? Because I don't want the subsidies. I don't want the government getting a larger share of their hooks into our health insurance market or how people access health care. But it seems like the path that we're on, that's what Democrats want. And they run government. And even when Republicans are in charge, they still run government. And so it seems like everything trends towards their stated aim, which is to turn us into Canada, where people have to fly somewhere else to get things done.
Right. You know what? I'm actually optimistic about this whole conversation. It sounds like I'm not, and I realize I'm on shows a lot, and I feel like I depress people, but there are bright spots out there where it's working the way it should. I would tell you that we do not have enough free market forces in our healthcare system. I know there are people out there that would say capitalism is the reason our healthcare system isn't working well. I don't agree. If you don't know, in capitalism, you have access to information to consume well, to be a good consumer. You know cost and quality. If you and I were going to say, let's buy a big screen TV or something, or a car, we could use our smartphone and very quickly, boom, we could get information to consume well. You can't do that in healthcare today in this country. The system is built to avoid free market forces. So let's try free market in healthcare and see how that works. And I feel very strongly it'll work very well. And I believe that because you have evidence of that already in the system. Anywhere where you take the insurance payment model out, so elective procedures that are cash, LASIK, cosmetic procedures, things like that, you see consistently year over year quality goes up and cost goes down. Whereas when the insurance payment model is involved and you don't have transparency, a consumer does not know anything about the actual cost of what they're consuming, the quality of who's providing it, cost goes up and quality goes down year over year. It's consistently true. And I think if we can, in cases where we see that happening, where you give consumers good information and you reward good consumption, you get the outcomes that you would want. I think that's the future. And I think employers are getting pushed into a spot where they are being forced to demand those things in their health plans. And that's going to save the system, in my opinion.
Yeah, so I think that's going to save the system. And when you talk about a free market system, there's a diversity of options available. We would never allow there to only be 5 big, huge, enormous restaurants in, the Metro St. Louis area. But we have, about 5 major hospital systems. Now, mind you, hospital systems are a little different than restaurants, but they still serve people. And so when you're looking at healthcare options and things that people can use to access it, people will have this idea of, well, why would we use that, or why would we use? But you never hear that on other things. Why did that new form of car, like Tesla's? Oh, he started his own car company. No one said, well, why are you doing that? There are already enough car companies. Or, there's another restaurant that's opened up, another Italian restaurant. No one says, well, why are you opening another Italian restaurant? You just assume they're going to serve something different that you're going to like. And so you continue to go, you start going there and continue to go to the other Italian restaurants you went to. So in healthcare, I think we really need a mental shift. People need to look for different options, more competition, so that we can break out of this kind of rut where it just seems like the options are getting fewer.
I agree. Yeah, and those are out there. You mentioned medical cost sharing. I think that has been exploding, as it should. It puts you in the driver's seat of the consumer. And direct primary care, same thing. It used to be when health insurance started, it was there for catastrophic things. It wasn't there for when you got a cold. That was something you paid out of pocket for, but it was a reasonable expense that you could budget in as a family, and health insurance was there for the catastrophic illness. And then somehow over time, it evolved into something where you could just go on demand, and you paid $5 or you didn't pay anything, and then it became $5 and $10 and $20 and so on. And we really took the consumer out of it. And I think that was the beginning of getting off track. When the consumer stopped consuming, it was it was a really bad turn for what we're doing. And we have a small company, and we offer direct primary care with medical cost sharing, and all of our. I mean, we're in the business, but you know what? We have lots of employees that aren't healthcare professionals, and they have access to the information they need to consume well. And if they need to have it, I had a surgery recently. I was able to talk to a nurse and I'm in Nashville. Here's the 3 top surgeons in what you need. Is a hernia repair, because I figured during COVID I should buy a kettlebell and give myself a hernia. So,
oh, no.
Learn how to use it on YouTube, not the same as a trainer. So, but I was able to find out, okay, if I go to any of these 3 surgeons, boom, my share of cost went way down, and I had the confidence of knowing it was one of the best in my area, and my costs would go down. I mean, that's really not that complicated when you take the insurance payment model out of it. And there's a growing movement around the country of people that want to fix this. I think from all stakeholders in this conversation, providers, you got doctors, you got hospitals, even hospitals. I wouldn't say insurers per se, but the medical cost sharing can kind of fill that bucket. You have a growing number of people and interests that want to do something about this, and I do think the future's bright. We're going to fix this. It's kind of the American way. We're going to fix this. We're going to get free market forces going and eliminate the waste and stop the profiteering. It's okay to make profit. It's fine. In fact, you should, but you should be transparent about it, and it should be fair and reasonable. That's all. Drugs are a perfect example of where that gets off track. It shouldn't be that we pay 10x what other countries pay for the same drug out of the same factory. That's ridiculous.
Wow. So I'm with you on that. That's why my husband and I started our own health share. We have a Christian health share that we literally just started because we don't think enough Americans know what health sharing is and how they can be in groups of like-minded people, share their expenses, and kind of avoid being in a market that, maybe your health insurer supports abortion and different things that are morally repugnant, or just being in a group with like-minded people and sharing expenses because it is cheaper and more cost-effective. So there's a lot of reasons why people might want to do it, and I think your company, you provide a service in this arena. There are a lot of people out there who are looking for ways to reduce costs, make it more effective, and in other words, the free market solution that exists in the private sector. We need more PCS advisors. We need more. We need more companies that are working in this space to actually bring costs down and give consumers what they need, which is access.
Yeah, exactly right. It's out there. It's a growing movement, and I think just buyer beware. Be a good consumer, and don't. If you get a bill in the mail, don't just pay that thing. I mean, question it. It may not be right. There's all kinds of bad actors out there, unfortunately. So you need to be a good consumer in healthcare. And for some reason, we've trained our population to be bad consumers for healthcare and good consumers for just about everything else. And we've got to fix that.
We got to fix it, and right away, because the free market is going to bring us more options, and it's going to drive down costs. And we know that in every other arena, and healthcare is not different. It deals with a different, product, but it's certainly not something that the free market can't help us manage and enjoy. I think there's a certain enjoyment that comes from knowing that you're not wasting money and you're spending money effectively and you're getting the service that you want. And I think that's possible here. If it's possible anywhere on the planet, it's here in America.
I agree, 100%.
Okay, well, you know what? When you said 5 kids, I thought to myself, there's a lot of cuteness that's going to be going on over at the Seegert household tomorrow. Thanksgiving is going to be a hoot. Enjoy. Thank you so much for joining me.
Thank you. Thanks for having me. Have a great night.
All right, you too. Have a wonderful evening. That's Paul Seegert. He's a managing partner at PCS Advisors, at PCS Advisors on Twitter. Happy Thanksgiving. We'll be right back.